I will now demonstrate a technique to differentiate between the segments of the upper cervical spine. This technique can be used as an evaluation as well as a treatment for postural conditions, upper cervical spine dysfunction, and cervicogenic headaches. To begin the differentiation, locate the mastoid processes and the inion and place your pinkies and your index fingers on those locations respectively. Your ring finger should fall directly into your OA joint. Let's take the OA joint on Eric's right side in this location. This is the C01 facet joint. In order to mobilize that joint, we take our thumb and mobilize toward the eye on that same side. So I'm mobilizing in a cephalic direction. To isolate the C2-3 facet, we want to find the C2 spinous process by dropping directly off the inion, right here. We then locate the facet just lateral to that. In this location we have the C2-C3 facet joint. To mobilize straight down toward the table. Again, always assessing for patient's response and for the concordant symptoms. To assess for the C1-2 facet joint, we want to do a similar position as we did for the C2-3, but we want to position the head rotated 15 to 30 degrees to that side. So I'm going to take Eric and I'm going to rotate him just as so. So his head is positioned, rotated to his right. I then want to place my thumb again on the C2-3 facet that I located before. So again I find the C2 spinous process, drop off just laterally, but this time to focus more on the C1-2 facet, I want to mobilize directly toward the patient's mouth. So the positioning of my thumb is unchanged, but my mobilization direction and the patient's head rotation is now changed. This isolates more movement at the C1-2 joint, but doesn't completely restrict mobilization of the C2-3 facet. And that is how you differentiate between upper cervical spine segments.